What classes should a massage therapist take after they have an MLD class under their belt in order to help clients after plastic surgery recover from their liposuction surgery? So my name is Kathleen Lisson. I'm a board certified massage therapist. I teach continuing education classes, and I'm the author of the Plastic Surgery Recovery Handbook. So I get this question emailed to me, messaged to me all the time. So what I will say is, the environment that we're in 2023, 2024 is different than how it was definitely when I got into massage therapy, and definitely even before the pandemic. Before the pandemic, if you could find someone that knew MLD and was having it on their business card, it was amazing. And then people would just automatically call you and say, hey, I had plastic surgery, I had liposuction, can you help me? But now it seems like a lot of massage schools are loading in those MLD classes in their massage school curriculum. Therapists are coming out and they're putting that MLD, that they know lymphatic massage, right off the bat, right outside of massage school. So the number of clients that are going to call you and book with you and rebook with you are not going to be as much as they were maybe before the pandemic. So you need to kind of up your game by taking more classes that are more tightly focused on how can I use skills in addition to the MLD schools I have to help people after plastic surgery. So this is the guidance that I give when people email me. I have big two classes, my first two classes that I always recommend to people, because you need two things to really get started and get going quickly in this business. And that is, one, you need the skills, which is my plastic surgery recovery and fibrosis massage class. That has continuing education credit. And also you need marketing skills, because the people need to find you. When you're talking to plastic surgeons, you need to see what documents I send to plastic surgeons that get them to refer clients to me. You need to kind of see how you can make a media presence for yourself. So when those plastic surgeons are looking at your background, and when those potential clients are looking at your background because they have a sheet from their plastic surgeon that says, get lymphatic massage, here are 3 choices, you want you to be the number one choice. So that's why I have people absolutely invest in taking the marketing class as well. So say, hey, you've taken your MLD class, you're confident with your MLD, you've taken the fibrosis class, you've taken the marketing class, you're feeling good, and you kind of want to get some additional skills. That's when I have kind of these little specialization classes that are also available for continuing education credit. I have a fibrosis massage cupping, lymphatic massage cupping class. So if you already have cupping as a part of your practice and your massage therapy practice, definitely take that one. And then if you want to start taking other clients in addition to the liposuction Brazilian butt lift clients, I have a class on tummy tucks. So it's not just, hey, which direction do I do my MLD for a tummy tuck? It really is knowing what operation they had, knowing what the surgeon was doing in the operation, knowing why you're seeing these things checked off and these drugs being written down in the client's health history form, to really get that confidence so that you can have that conversation, and the person who got your name and is coming to the first appointment with you for a tummy tuck trusts you enough to rebook that second appointment. Same thing with the facelifts. You need to understand that the lymphatic drainage of the face changes when we make a cut right here, right around those preauricular lymph nodes. You need to know how you're going to massage the face. You need to know the type of things that I do to help with some hardness here, some hardness here. That will take you, again, from a client picking your name, booking one appointment to you, to the client saying, oh my gosh, I feel so much softer. When should I rebook? Because it's all about getting the rebook. It's not about getting all these clients one time or maybe 2 times. It's about getting them to rebook and use you all throughout their recovery. And then I also have 2 resources if you are looking to help clients who have a lipedema diagnosis. And to put the cherry on the cake, I absolutely am going to invite you to get and read a copy of the Plastic Surgery Recovery Handbook. This is the book that I give to all my clients on their first visit, and they come back to me and they say, I'm halfway done with your book. I finished your book. This is such a great resource. And what I did is I wrote down all these common questions that client after client is asking. What are the foams for? How should I arrange them in my garment? What is fibrosis? What things can I do in between the appointments to soften up my skin and my tissue after surgery? And all these other tips, and I looked at the research, and then I drew from the research and quoted the research and published journal articles to give you the answers. So if you read this book, you can go ahead and have that intelligent conversation with the client. And the intelligent conversation with the client is going to get you from just seeing someone one time or maybe 2 times to them saying, oh my gosh, Kathleen knows so much, I need to rebook with her. And then they will go back to their plastic surgeon and say, Kathleen has been, or your name has been such a great resource for me in this recovery. Thank you so much for recommending her, which then that surgeon feels confident enough to recommend you to their future clients. So that's my answer in a nutshell of the types of classes that I would recommend you take, and then this really great resource in the Plastic Surgery Recovery Handbook that can really get you the tools that you need to confidently have these conversations with the client, being able to answer their questions, being able to explain why you're doing massage at a certain stage of wound healing and why you're not going to do this different type of massage at a different stage of wound healing. That really gives these clients confidence in you, and confidence means that they rebook and rebook with you.